In this presentation, I'm going to talk about oral health strategies for the diabetic patient. This is another one like cardiovascular disease where the association is extremely strong, and all of the research currently is showing a very, very strong connection in that improvement in gum health improves the stability of blood sugar and overall treatment outcomes for patients with diabetes. This is super, super important. Okay, so let's talk about diabetic risk factors. Diabetes is a risk factor for periodontal disease. Okay, we all know that. Diabetics are more likely to develop periodontal disease. And bringing your oral bacteria environment into balance, I use the term balance a lot because I want my patients to kind of be understanding. It's not the elimination of bacteria. We coexist with bacteria. But there's good bacteria and there's bad bacteria, and when you have a shift in your bacterial load where the bad guys predominate, then that's when inflammation and disease occurs, okay? So we just need to achieve a balance, and in the mouth, it's a relatively simple thing to do. So we're going to work with your primary care physician and to talk about your overall treatment plan and what we can do as dentists to minimize the oral impact and the oral consequences, because we know that if we can get your mouth in a pristine condition, your primary care physician is going to have a much easier time of getting stability in your case. Okay, so our treatment objectives focus on keeping the oral bacterial load in balance. We're going to review your medical history, your family history, your current periodontal condition, and screen for the oral pathogens that are implicated in both cardiovascular disease and in diabetes. One of the tools that we use is video microscopy, very inexpensive, very simple initial screening test to see what your biofilm looks like. This is a little handout that I use, and it's educational in nature because it takes you through the process of what good bacteria looks like, what bad bacteria looks like. This is a tooth, this is the gum, this is the pocket that you hear about. When this pocket gets ulcerated and bleeds, these germs jump in that pocket and jump right into your arteries, and they're in your circulation, okay? It's a very, very simple conduit. So we need these gums pink, really tight and healthy around the tooth to prevent the bacteria from jumping into your bloodstream. This is what we call advanced salivary diagnostics, and these are oral DNA tests where we can actually, these are the bad guys that have been identified, high risk pathogens, medium risk, low risk, and we can measure exactly the level of these pathogens and treat accordingly to specific therapeutic targets. Okay, and once again, this requires a personalized approach based on your current condition and overall health. We want your bacteria and your saliva to be in balance. Some variation of our oral disinfection protocol may be implemented. This varies from patient to patient. It just depends on how severe, whether it's an early case of gum disease, moderate to advanced. Okay, but we need to knock down the level of the bad, what we call pathogens, the bad bacteria that are in your mouth. And a specific long-term regimen includes product recommendations and the proper interval for you to return to the dentist to see the hygienist. This is an oral disinfection with an ultrasonic scaler. Many of you probably had your teeth cleaned with this. The difference that we do is we use specific antiseptics in here to irrigate the tissues as your mouth is cleaned. We're always using antiseptics, okay? For the home care, we're going to train you in daily biofilm control, and I talked about that in a previous video. Neutralizing regimen, xylitol, antimicrobial, floss pick, and water pick. It's just almost a requirement to use these devices to get in between your teeth more efficiently and effectively. These are some of the home care products that we talk about, and each patient will have a different level of recommendation as far as home care products. This is some breaking research that is truly, truly remarkable. This study was actually done by some insurance companies, and it talks about reduction in hospital admissions, physicians visits. This is what, 61%, 41%, 32% reduction in medical costs for patients with diabetes who are under periodontal care. And what I mean by under periodontal care is an example of what I'm saying is that you're seeing the dentist regularly and you're receiving the proper disinfection protocol, your bacteria is under control. If you don't think this is cost effective, this is emerging science right here, okay? The insurance companies are catching on to the fact that the dentist is very important in overall healthcare costs, and this study that was done in 2012 was the first one to really point this out. So, your recare visits to the hygienist are customized. It's essential to monitor your condition, and each person will have a specific interval that we determine that keeps you stable. And this will vary, depending on your immunity, your resistance, your diet. We're going to talk about all those things, but the important thing is that we monitor this on an ongoing basis so that we know where you stand. So our goal is just to assist you into achieving a stable overall healthcare outcome.